The current definition of type 2 diabetes is broken, and this video will fix it. Hi, I'm Dr. Mateen Sidd, and welcome to this short video on what is type 2 diabetes, the real definition every diabetic needs to know. In a moment, I want to reveal to you the DH scale, the key concept which I have developed, which helped me stop and reverse my diabetes problem and can help you do the same. But before that, dear friends, the conventional definition of diabetes is broken and grossly incomplete. Here is a patient doctor scenario for you. You got a severe headache and you visit your doctor. And you say, Doctor, I have a severe headache. The doctor says, Okay, take this painkiller. You ask the doctor, Doctor, what's happening to me? And the doctor replies, You have pain, take this painkiller. Do you see what's happening here? The doctor is actually defining pain as your problem without giving any underlying details of what's causing the problem. This is called as the kill the messenger approach to medical problems. You see, blood sugars are actually not the problem, but the doctor says blood sugars are the problem. Where in fact, the blood sugars are saying, Don't shoot, we are just the messengers. And this is happening to diabetics all over the world. The definition given by the major organizations like the WHO doesn't help either. Here is the WHO version. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and nerves. Yes, this definition doesn't give us any understanding of why do we get diabetes in the first place. As Sun Tzu says, to defeat your enemy, you must first know it. So let's redefine diabetes for what it is. Diabetes is best defined as a metabolic dysfunction due to insulin resistance or low insulin secretion caused by obesity, low physical activity, and stress, all these resulting in high blood sugars. And at this point, you are labeled as a diabetic. As you can see, this definition gives you the reason, the complete picture of diabetes, right? Diabetes is a dysfunctional metabolism. It's an energy management problem. And when this happens, you cannot process carbohydrates, cannot process proteins properly, even cannot process fats properly, right? And then what happens with all the unused energy? It stays in your blood as high blood sugars. And the report comes out at a very high blood sugar value, and the doctor says you got to be put on medication or insulin or even bariatric surgeries. To summarize, diabetes is a dysfunctional metabolism, an energy management problem, mainly caused by insulin resistance that results in raised blood sugar levels. Now, so to beat diabetes, don't ask how do I lower blood sugars, but rather ask how do I overcome insulin resistance. You should not ask what foods should a diabetic eat. Rather ask what foods help me overcome insulin resistance so that I become a non-diabetic and enjoy any food I want. And that will give you the complete approach to diabetes. So the bottom line is this: upgrade your metabolism and leave diabetes behind. That brings to a question. You might be asking, but are drugs and insulin injections doing that for me? The answer is sadly no. No drug or insulin can upgrade your metabolism. At best, they are actually band-aid approach, which are actually just tackling the cause, not the cause, or rather just the symptom, which is high blood sugar levels. And you have to tackle insulin resistance to overcome diabetes. So what cells actually become insulin resistant? Three cells, mainly the liver, the muscles, and the pancreas become insulin resistant. Especially the fat around the pancreas and around the abdomen become insulin resistant. You see, liver is the largest or the biggest storage house for glucose. It makes glycogen from glucose and stores them so that you can release them later when times of needs. Now, when liver cells no to insulin, that is insulin resistance happen, blood sugar level starts to rise. Your muscles are not far behind. They are the second biggest organ to store glucose. Why? Because movement needs energy and the stored glycogen breaks down and gives glucose and ATP, the energy currency of the cell. Fats, insulin actually is a fat storage hormone. But when insulin resistance happens, the body cannot store good amount of fats, or rather, it starts to release fats, and as you know, they come into the blood, and the blood fatty levels increase as well. Now, all this happens, right? And all this happens will result in a high blood sugar level, which is now becoming insulin resistant diabetes type 2. And the big symptoms of diabetes are all a result of this insulin resistance. So you can say that my diabetes is a metabolic dysfunction. It is not due to a lack of drug or a supplement or even insulin. It's my body's inability to use the energy it has that is pushing it, the high blood sugars to higher values, or the blood sugars to higher values. Now let's make metabolism functional again and say goodbye to diabetes. Now before I end, here is the DH scale or the continuum I promised to you earlier. Now, if you see the continuum, we start with peak health values from 70 to 80 milligram of blood sugar levels, whereas the diabetic values are more than 126 milligram per deciliters or percentage in the blood. Now, if we see there are intermediate stages like a non-diabetic stage where you are still in the green zone, less than 100 milligrams of fasting blood glucose values, and then you might move on to a pre-diabetic stage, which is from 101 to 125 milligram per percentage. Now, remember this, you do not move from peak health to a diabetic stage just like that. You actually move through intermediate stages, like you move to a non-diabetic stage and then to a pre-diabetic stage and then to a type 2 diabetic stage. And again, if you want to become healthy, you have to move across. You have to reverse diabetes and become a pre-diabetic in the first instant, then go towards the greener values and become a non-diabetic. And your final goal is actually to become a peak health where you have got blood glucose values in such a beautiful range where you are very far away from diabetes. Now, what's your impression when you look at this? What's the main takeaway from this picture? You can reverse engineer diabetes and move to peak health and energy instead. Leave diabetes behind. Yes, it's possible to reverse diabetes, but you got to know a good approach. What I am using is a performance-based 4 doctors approach. In my next video, I'm going to show you the 4 real cause of diabetes very few doctors know and even fewer are willing to do something about. Now, if you got value from this video, please share, like, and subscribe to be notified of some amazing diabetic reversal videos that I have coming up for you. And join me at bediabetesproof.com. Until then, be diabetes proof. You will love my free 10-day diabetes freedom plan. It's a plan which shows you how to reverse diabetes naturally. You will see the all 4 doctors in action. You will learn from Dr. Diet the exact dietary strategies which diabetics can use to optimize their blood sugar levels in the short term and overcome insulin resistance in the long term. I will also reveal to you some of the best recipes which I use and personally tell my clients to use with amazing results. You will also learn about doctor movement, how exercise can help you not only lower blood sugar levels but also overcome insulin resistance in the muscles. See, diabetics become weaker as they go through their diabetic cycle. So if you overcome the muscle resistance, insulin resistance, you become stronger and healthier. Then you will also learn about Dr. Quiet, how sleep and napping plus meditation during the day can actually help you overcome insulin resistance, beat the inflammation going on in the body, and overall help you stop and reverse diabetes. And all this will be brought into picture with Dr. Happiness, where you will learn how to align your values, which you have, the health values and life values, with your diabetes freedom plan. You see, most diabetics lack the motivation to follow through a good lifestyle changing program. Why is that? Because their values are not aligned. You will learn these amazing secrets how to align your values, which you already have, with a diabetes freedom plan, so that you get the kick, the extra motivation required to follow through the program and make this life changing program a success. You can just visit bediabetesproof.com, or the description has the link with a 10-day free plan. You can click on that and just download the program and use it, because this program right now is free, but I intend to sell it in the future. So grab your copy today.